Welcome. I'm Lee Doherty Biddison.
And I'm Carolyn Kamsty Fowler, and we're your co-hosts for the Johns Hopkins Office of Wellbeing's podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare.
We spend a lot of time thinking about how to influence workplace well-being in healthcare, and we're excited to share what we're learning.
Thank you for joining us.
Hi, I'm Lee Biddison, Chief Wellness Officer for Johns Hopkins Medicine, and your host for this episode of our podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare. I'm excited today to introduce my guest, Corey Feist, who is co-founder and CEO of the Dr. Lorna Breen Heroes Foundation. Corey, welcome.
Thanks for having me, Lee. It's wonderful to be here with you today.
So excited to have you on our podcast. So today we're really hoping to talk about catalyzing transformative change in workplace well-being and doing that on a national level. Obviously, it takes one person to change their space, but if we want to go big, Corey and I have known each other now for a little while, and Corey is my go big or go home friend. And so we're going to take this opportunity to talk about trying to do this, on a national level and really make an impact. But before we go there, Corey, for those who are listening who maybe haven't met you and aren't familiar with the foundation, will you tell us a little bit about yourself and about what the foundation does?
Sure. It's wonderful to be here with your listeners today. I grew up as a lawyer in healthcare. That's where this began, this journey. In the late 90s, spent time embedded as part of my legal training in law school at actually Penn State Hershey Medical Center. It's where I got to see what it might be like to work indoors inside a hospital system. And then I went into private practice after that, and then quickly returned inside an academic medical center, which is based in Charlottesville, Virginia, the University of Virginia Health System, where I spent quite a bit of time working on a variety of legal and regulatory issues, which now your listeners are already turning this off. So we will quickly move past that in the story. But had an opportunity to become the general counsel of the organization that employs all the physicians and the advanced practice professionals, called the University of Virginia Physicians Group. And I really transitioned to the clinician side of the business of medicine, returned to get my MBA, and then became the CEO of the medical group shortly thereafter. And I spent a lot of time over my 20-plus year career at the University of Virginia Health System watching the weeds creep in the garden when it comes to administrative burden that's been shifted onto the workforce. And so spent quite a bit of time trying to cut back those weeds, whether those weeds were in the form of things like prior authorization or in the forms of the electronic medical record, or just this increasing shift. In the spring of 2020, we experienced a family tragedy when my sister-in-law, Dr. Lorna Breen, an emergency medicine physician in New York City, experienced a mental health episode following COVID, and returning to the workplace too soon when she was not at all recovered, but felt compelled to run back into the burning buildings like the firefighters did on 9/11. Lorna's experience quickly moved from her first singular mental health experience to expressing concerns to me and her little sister, Jennifer, who's my wife, about the ramifications on her career for obtaining mental health treatment. Shortly thereafter, she died by suicide, and we began to hear from the workforce in droves. The volume of communication that we received after her death on April 26, 2020, was a tsunami of feedback that I, as a healthcare leader, had never heard or had not maybe realized was under the surface all along, which are these mental health concerns that healthcare professionals have, and the really intense stigma around help seeking, let alone getting mental health treatment. That feedback, which continued in earnest for years, was the driver of creating the Dr. Lorna Breen Heroes Foundation, which serves to support the well-being and mental health of healthcare professionals of all types across the country. Our mission is to reduce their burnout, improve their job satisfaction, and we envision a world where seeking mental health treatment is universally viewed as a sign of strength. We've had quite a busy run, an impactful run for the last few years. But I think the most important thing for your listeners to know is that healthcare professionals are human too. That may sound trite, maybe overused, but they're not treated as such when it comes to having to take care of themselves or recognize the humanity in the practice of medicine. And we all need to do a better job, whether those are policymakers or healthcare leaders or just the general population, recognizing that we desperately need healthcare professionals to be able to provide this critical infrastructure for healthcare in the country. And in order to do that, a very critical element of it is just recognizing their humanity and supporting them just as they have supported us for their whole career.
I love that. I've often reflected about, there's a lot of talk in training about, how we navigate the doctor-patient relationship. And I think that word is key. It's a relationship between two humans. And yes, we as clinicians, as physicians and advanced practice providers, nurses have a responsibility to our patients, but we do also bring our humanness to that space. And it's so important for us to acknowledge that. Well, this is so deeply personal, right? We're as we focus on the mental health space, so deeply personal. And I sometimes struggle to think about how do we take this to this sort of macro level and tackle it in a structural way that's meaningful and still acknowledges that unique sort of personal component. Tell us a little bit about your thinking on that.
It starts with listening. And, sometimes leaders of all flavors start with their mouth when they need to start with their ears. For me, there is no better example of that than listening, reading, and just the blessing, if you will, that was the feedback after Lorna's death. That Lorna's experience was not an anecdote, but really a very consistent experience by many. And when you listen, and then you follow up with a question like this one, Lee, what does it mean for you to feel valued and supported as a clinician in this environment? What you get in response to it is the gold. It is what you need to act on.
Yeah.
And so in some ways, it's just very simple. It's human conversations. It's personal conversations. Unfortunately, those are hard to scale, if you will, right? Everybody in business is trying to scale the solution. It lends itself to scale, but you have to go slow first to go fast, if you will, right? So,
Yeah.
and that going slow part is really having these individual conversations. I remember that a key piece of research that came out of the American Medical Association during the COVID-19 pandemic was the survey results from this survey that they administered across all healthcare professionals, all staff, called Coping with COVID-19. And during that time, one of the big takeaways was that about 50% of the healthcare workforce, regardless of role, felt valued and supported by their employer. And I think one of the struggles with that folks, at least in the conversations I was having, were really struggling with is how do you scale a solution to that? Because it is so personal.
Right.
But what you can do is you can then train the leadership to have those individual conversations. And it's not that leaders necessarily have to act on every single response. But I think when you start to see themes and hear themes like we've heard over the years, that gives you a direction to focus your energy. So it's important to listen, and it's important to focus and tailor your response to what you're hearing. And that's been really, in some ways, our approach. The last thing I would just say that I think is also really critical, particularly in healthcare, and for those non-healthcare listeners, healthcare is such a siloed industry. Every specialty, every inpatient unit, outpatient unit, every hospital system is really quite siloed. Even if they're in a health system, you often find that, the department on the second floor doesn't know what's going on in the department on the fourth floor. And as a patient, you may not see that. But the point in all of that is to say that taking an interdisciplinary approach to this work is absolutely critical. And so when you start to listen, when you start to then focus, and when you're listening not just to one singular type of voice, but to all the voices in a hospital system, then you start to be able to craft solutions which will improve the workplace, which ultimately is what we're about, because the mental health of healthcare professionals is heavily driven by the workplace environment. And so it's incumbent on all of us to try to work tirelessly to improve the workplace environment so that healthcare professionals can do what they train to do,
Right.
which is take care of patients or do research or teach, whatever their flavor, but primarily patient care, right?
Yes. So many things to ask you about. One of the things as you're talking about the silos and the interdisciplinary conversations that need to happen, I reflect my background is in pulmonary critical care and internal medicine, and every internist and probably surgeon will tell you that um, the sort of interactions with the ED is always never what we wanted. There's something they didn't do, and this would have been Lorna. Why didn't Dr. Breen put in a line before they sent this patient up? Why didn't they send this test? Why didn't they do that? And over the years of my practice, I've come to realize that situational awareness piece is so critical. In an academic environment, I try to bring this up as often as I can when we start getting grumpy about, well, we didn't like that consult that we got, or we didn't like what the ED did. Is do we know what's going on? It could very well be that patient that didn't have some test sent came up to me quickly because they were chased in the door by 3 traumas or a call out or things that we don't know about, and those and working to people make mistakes. I'm not saying that that there's an explanation for everything, but there are an explanation for a lot of things that if we understood would make a big difference in how we communicate with and support each other, for sure, for sure. um let me ask you this. You're talking a lot about listening. I'm curious about one or two things that maybe surprised you, to this point in your journey, things you heard that you were, sort of thought, did not see that coming.
Well, I'm glad we have 4 hours for the rest of this conversation. The first thing that surprised me as a non-licensed healthcare professional was Lorna's story and Lorna's concern around obtaining mental health treatment and what the ramifications would do, and how reinforced those concerns are beginning in the earliest days of training, medical school, even undergraduate education. How the f- and so maybe a broad statement there would be, I had no idea about how stigmatized mental health care is within healthcare as a profession, let alone taking a break. And I know that there are a lot of professions where, the law, as an example, you have people who go into this because they are very driven people. And so you're going to get that obviously in healthcare. It's part of your toolkit for success. What I had no idea about was just how many, many real penalties or perceived penalties exist for licensed healthcare professionals, doctors, nurses, pharmacists, et cetera, for doing that. I think that's been a huge part of this work. And it's really driven a huge part of our impact and our solutions at a national level. But I think that for me, that singular issue, and then it's not just my lack of knowledge. When I talk to healthcare leaders, particularly healthcare leaders who are not physicians or nurses, and you raise this, they kind of look at you like, wait, what? Which was what we were saying to my sister-in-law when she started to express these concerns to us. Wait, it's at that point 2020, now 2024. What do you mean this? There's a thing called the Americans with Disabilities Act. Like, what do you mean you are penalized for it? So I think that's been a huge thing. And I'll just share with you, I was recently in a conversation with a staff member as a member of Congress who was asking us about the Dr. Lorna Breen Healthcare Provider Protection Act. And when I started to bring this up, that staff member actually stopped the entire conversation and she turned her head to the side and she said, "Wait, what? Are you telling me?" And I said, "Yeah, this is a real thing. And it was not just a singular moment." And so I think that is one of our biggest surprises. And I would also say, kind of on the other side of that, in the good news department, now that our foundation has put out a solution set for that, we've put out a toolkit for free for any organization to use, whether that's a hospital for their local credentialing questions, or a medical board, or a nursing board, or a pharmacy board, or a dental board. Their willingness to change and act rapidly, use our toolkit, apply for our badge of recognition, which is our All In Champions Challenge badge, which is intended to be and become a visible sign for the workforce of where they're not going to be asked about their prior mental health treatment and diagnosis, which is that big concern. That, in a very good way, to see that progress so quickly. As you know, healthcare kind of moves at a glacial pace when it comes to changing its behavior, but the reception to that and the speed with which leaders of all makes and models, whether you're a licensing board, executive director, or board member, or a hospital CEO, CMO, COO, et cetera, that's been also similarly important and a big aha moment and surprise in this.
Let's dive a little deeper into the toolkit just to and get you to tell us a little bit more about that. I will say for our listeners who maybe aren't in healthcare or aren't licensed physicians, I have been struck, and when I talk about this, what I always say is it really says something to you subconsciously if you fill out an application for licensure or for credentialing at a hospital and you're asked about your mental health immediately after being asked if you are a convicted felon, which is actually the way that it goes often. Like
It's unbelievable. It's unbelievable. It harkens back to this day where folks disconnected, mental health from physical health, and it harkens back to a day where you were thought of, if you had a mental health condition, as being less than, and it being criminal, if you will. And so if you think about that also, Lee, and then how that could translate into how you then view your patients with mental health diagnosis. And then, because of all of that layering of stigma, individual external stigma, and then this institutionalized stigma that you're experiencing with all these questions, how could you ever see yourself as a patient in need of mental health treatment? There's just too many signals around you that is bad, and it is at a minimum career threatening if you were to dare tread into that ground.
Yeah, it's honestly pretty astounding. And I think that another question though that should be asked, and I know that you guys have thought about this, is, well, Corey, are you saying that it just doesn't matter if people have mental health issues? Because I mean, and I think this is, our mental health need mental health care, and I think this is important because, if we're using a biological basis for thinking about mental health or mental illness, then we know you can be impaired by any physiologic disease. You could be impaired by diabetes. You could be impaired by heart disease. You could be impaired by, so it is reasonable and appropriate to say you can be impaired by mental health issues or mental illness. But, and I know that this is not what the foundation is saying, but what do you say to the people who say, well, I guess it doesn't matter?
Well, so what we want and what matters is that people, whether they have diabetes, I'm so glad you brought that up, whether they have a medical condition or a mental health condition, that they get help. That's what matters. And that's what we're trying to inspire and break down any barriers to. Because as you know, being treated for any condition can often result in you getting better. It often does.
Right.
But if you don't treat that diabetes, if you don't treat that macular degeneration or or your depression, things can get out of control and be harmful for you and for those around you. And I think that's actually the point. So the Americans with Disabilities Act allows an employer to ask questions about whether or not an individual is currently impaired. And that's completely appropriate.
Right.
What's not appropriate is to say, Lee, have you ever gone to therapy in the last 10 years?
Right.
I mean, now that COVID's happened, I'm not sure I know anybody who hasn't. And so
That's right.
any clinician who has to answer that question now is going to be forced to lie. And then you sign on the dotted line that everything in this document that you submitted is truthful. And if anything isn't truthful, you can be terminated. So, wow, here's an idea. Let's put your entire career on the line for something as trivial as getting yourself taken care of. If you know, that's the narrative. That's the self narrative,
Yeah.
right? And so what we want to do is we want to have people in treatment, and we want that treatment to be, whether that be a physical condition or a mental health condition or both. We want people to feel the fact that they can get this treatment without negative repercussions on their ability to have a career and to take safe care of patients.
I love that. This is so important. All right, let's go back to the toolkit for a second.
Yeah, sure.
So, we're again talking on this very personal and individual level. And what we want to do is create systemic change. And one of the ways to do that is by, sort of disseminating tools. So can you tell us in a little bit more detail about this tool? And I know there are actually other toolkits and resources that the foundation is also promoting.
Absolutely.
about
And so let me just maybe set the table for why this is important. This would be important even if it was just Lorna. It's more important because this is much bigger in scale and impact. So the Dr. Lorna Breen Healthcare Provider Protection Act was the federal law that was created after Lorna died. It was the first ever federal law that created programs to support the mental health of healthcare workers and to reduce suicide. One of the byproducts of that was the American Hospital Association's work with the CDC to publish a suicide prevention guide. In that suicide prevention guide, it identified 3 key drivers of suicide among health workers. And the first one that they list is the stigma and concern around getting mental health treatment. So this was not just Lorna's concern. This applies to all. So I wanted just to put that into the context for a minute. So what we have done is we have created tools which are on the drlornabreen.org website, which allow organizations to audit questions that they might have on applications. And I'll talk about what those applications might be, change those questions, and then communicate the changes to those questions. So let's just go back to the top for a second. So what we've learned in this work is that healthcare professionals who are licensed, and I'm emphasizing a license for a minute, are asked questions that are inappropriate, which are about prior mental health treatment and diagnosis in at least the following areas. When they apply at the state level to be licensed, whether they're a nurse, a pharmacist, a dentist, a doctor, a veterinarian, if they are a doctor or an advanced practice nurse, when they apply to a hospital to obtain what's called credentials, to be able to perform pulmonary critical care as you so well do. They are also asked in that same credentialing application, their peers are often asked in a peer reference form questions about, for example, Lee's mental health state or prior mental health treatment and diagnosis. So you've got it at a licensing level, you got it in a hospital credentialing application, which has this little other document called the peer reference form, which means that Lee's peers are getting asked these questions about her. And then you keep going. So you wanted to get paid for your work? Your insurance company that pays you, your commercial insurance, they're going to have a similar kind of a form, same questions. Oh, you wanted to be covered by malpractice insurance, same kind of thing. So you've got these same issues that permeate. And so our toolkit has the exact same solution for each one of those because it's the same issue. Audit your questions, whether they're on a licensing level or one of these applications, change and then communicate. And when you do that and you submit those to our foundation for verification, because what we found is that sometimes organizations unintentionally create more of a problem for themselves when they do the work, even though our toolkit is excellent, the people can overthink it and unintentionally create more confusion in their documents. So we verify them, we give feedback, and then importantly, we give out this All-In Champions Challenge badge. The communication part of this, Lee, I think is the longer part because of what we've talked about. This work really begins, this work to build stigma starts at that early age. And so the work that we need to do to unpack and break down the stigma and stop the stigma needs to be reinforced over and over and over again, which is why for our foundation, what we've done is on that same website at drlornabreen.org, we have every September, we publish what we call the State of the States, which is if you're a doctor, if you're a nurse, if you're a dentist, if you're a pharmacist, you can click on your state on a map of the country and see whether or not we've been able to recognize your state as being free from these questions about prior mental health treatment and diagnosis. It also allows you to click into your state to see which hospitals in your state have done this work at a credentialing level. And then our hope is to expand that to insurance companies and others. But the concept is we want to be an impartial source of truth for clinicians, for their families. If their families are hearing something out of their loved one who's a clinician about these concerns, we want to be this source of truth. That would have been incredibly helpful for us as a family because Lorna was so convinced about the impact on her medical license in New York, and we couldn't dissuade her of that. However, come to find out that Lorna was incorrect about her medical license in New York. In fact, the medical licensing application in New York doesn't even have questions at all about mental health.
Wow.
So they were a best practice, and yet she had no idea. When I speak with medical students, when I speak with families of those who have lost loved ones to suicide, I always ask them if they're aware of the rules in their state, where they want to be. And not one person I've ever talked to, and I've talked to, as you know, I'm a professional talker, so I talk a lot. No one's been able to answer that question.
Yeah.
And that tells me that there's an opportunity here to make it clear, because in this context, if we simply communicating what the rules are can be and will be life-saving. So that's the toolkit. There are these challenges through our All-In Coalition, All-In Wellbeing First for Healthcare, Champions Challenge. Our badge is now benefiting over 1.2 million health workers in the United States. And we've got a lot more to go. I think there's about 15 million health workers in the United States. So that's not a bad impact. That's not a bad start. And we need everyone's help.
Including Johns Hopkins. We know.
We're
We're on it.
love your help, Lee, and everyone else's help. But, I will just say, just to inspire you for a moment about this, we had a medical student recently not in Maryland, in another state. That medical student went to the medical licensing board of the state and got the board to change their questions. A medical student is, early 20s, not the most on the pecking order of leaders, not the highest, but you know what? So anybody can help make this change. And that's inspiring that folks can make an impact like that.
This is totally inspiring. And I will share with our listeners that this is the top of our priority list as a team in the Office of Wellbeing this year. So we are very excited to partner with the foundation to get to where we need to be on this important issue. Corey, what haven't I asked you that I should have asked you?
The Dr. Lorna Breen Healthcare Provider Protection Act is up to be reauthorized by Congress. This was first of its kind legislation. it created programs across the country that are benefiting and have benefited thousands of healthcare workers. Congress, we did this in a bipartisan way. We did this with the support of hundreds of organizations across the country. Congress needs to reauthorize the law right now and re-up it, because every law that creates programs has a time-bound, the programs are all time-bound. So we need to extend it for 5 years, and then we need to have it funded every single year. So what you haven't asked me is what your listeners can do to help contact Congress. We have had over 13,500 people write messages to members of Congress, and we've got, again, a tool on our website. We're like Lowe's of tools, right? We've got all the tools that you need. Home Depot, Lowe's, pick one. Your local hardware store, we've got them all. But if you go to drlornabreen.org, send a message to a member of Congress. It takes 45 seconds to do it. If you want to use our canned message, if you want to write your own, we've seen hundreds of messages that have been personally tailored, which just reinforce why we do this work. So if folks are looking to take further action and support healthcare professionals across the country, having Congress reauthorize and fund the Dr. Lorna Breen Healthcare Provider Protection Act would be a huge step. And I think we have what we need to make sure that people understand is that the mental health of our healthcare workforce is worse than any other segment of the workforce in the United States. The Dr. Lorna Breen Healthcare Provider Protection Act is just one step in a whole staircase of health policy that we need to create to support health workers. And we've got to make sure that members of Congress know that the bill in its first 3 years had a great impact, but it didn't solve the problem. And we've got a lot more to do. So that's the last thing I would just ask for your listeners to make sure that they do. And if they want more information about it, they can contact us through the website as well.
Fantastic. I can attest, I have used that tool and sent a message to my congressman, senator. So it is easy, it was super fast. And I'm so grateful to have that resource to be able to add my voice. So Corey, thank you so much for taking the time to be here today. I've loved our conversation as always. And I know our listeners will have learned a lot, and we are excited to keep track of the foundation and what's happening moving forward.
It's been wonderful to be here with you, Lee. Your partnership personally, as well as the partnership with Johns Hopkins, has been huge for us. And I just want to thank your listeners also for paying attention today and supporting our healthcare workforce. They desperately need it.
So that's it for today. If you enjoyed what you heard, please share this podcast with a colleague. And as always, we welcome your feedback.
If there are any topics you'd like to hear about, please email us at owb@jhmi.edu.